If you are living in USA, UK, Canada, Australia, Dubai, or anywhere outside India, and your mother or father has recently undergone knee replacement surgery in India, you may be wondering how they are recovering at this moment. Are they doing their exercises properly? Are they walking safely? Is their knee becoming stiff? Who is helping in their activities? Who is doing the activities which can make them feel better? These are very concerns for families living abroad. I'm Dr. Ashok from Spandhana Pain Relief Centre, and in this video, let's talk about how you can actively support your parents' recovery after knee replacement even when you cannot physically be there every day. First, understand this. Knee replacement surgery is not the end of recovery. The surgery is an important step, but the journey continues afterwards. Afterwards means it's all about the recovery phase, what we call as recovery involves gradually regaining movement, strength, balance, walking confidence, and more than anything else, the independence. The goal isn't simply to go through the surgery, it is all about to help your parent return to everyday life as safely and independently as possible. So, what we are going to talk about, it's all about certain things that we have to take care, like make sure someone is actually supporting their recovery back in India when you're abroad. One of the first question you should ask that you should ask isn't did you do your exercise today? I mean, if you're asking this, have you done your exercise today? Instead of that, you can ask your parents who is helping you with your recovery, who is accompanying them to follow up the appointments. These are the questions you should be asking. Who is helping initially with walking and daily activities? Who is supervising their rehabilitation process, who notices if something changes or some ups and downs that are happening, who can physically be there if they need the assistance. These are some of the questions, right, you should be asking. Your parent may be perfectly capable of doing many of those things independently, but having the right support around them can make the recovery journey much smoother, right? So if you could bring in those things, don't become your parents exercise police, right? Don't ask the questions in such a way like a police. If this is something I want families abroad to think about, you may call your mother or father every evening and ask this question like, did you do your exercise? Which we usually ask, don't we, when you are far away from the place. And after a few days, both of you may get frustrated. They would be saying yes or no, that is the only answer, but instead become their recovery partner as what I had put it across. So this is something like which I would suggest to all those people who are staying abroad. There are certain things that you should be asking rather than just asking that, oh, are you doing your exercises properly? What has become easier this week? This could be also a question you could be asking. Are you feeling more confident? This is another question you could be asking. Recovery isn't only about counting exercises. It's about gradually improving function and independence. Most of the times we feel recovery is just one-way process. So you have to make their home safer. Always make sure your parents are in the safe place. After knee replacement, your parent may temporarily have difficulty with walking, balance, stairs, or getting around the house. So look at the environment around them. Make sure that environment is also proper. Are they having those things where they can keep themselves in comfort? Are there electrical wires across walking pathways, which can be a distraction? right? Is the bathroom that way they are having, they're cleaning themselves, is it safe place? Do they have something stable to hold on to it? If a place they are walking by are frequently used items within easy reach, is there a chair at a comfortable height? You have to think about these things. Do they have the appropriate walking aid if their treating team has recommended one? These small things can make a slight difference to safety and confidence during the recovery phase. Right? Take care of these small things. Ask them to take care of these small things. Make sure that rehabilitation isn't forgotten. Rehabilitation is a process. One of the biggest mistakes families can make is thinking that rehabilitation is just one-time process. The operation is successful, so everything is finished. That is what most of us think, especially the families that whose parents have gone through this surgery. So we have to think rehabilitation is an important part of the journey recovery. The more you take care of your parents in that way, where the rehabilitation program should be individualized according to the person's surgery. Make sure that those conditions, the medical condition, the strength, mobility, the range of movement, the pain and swelling, and the instructions given by the treating medical team are taken into consideration. Your parent may need different exercises at different stages. So please don't simply take a random exercise video from the internet and assume it is appropriate for everyone, because every recovery is different from one person to the other. They could be having the recovery of ACL, then it could be something of MCL for the other, especially I'm talking about the knees. What can you do from abroad is a question now. You may be thousands of kilometers away, but you can still play an important role. Don't you think so? As I've put some questions earlier, now you could ask, like, you could keep the track of appointments. Rather, you have asked enough, like, now you can keep the track of the appointments, you can arrange the transportation, make sure follow-ups are not missed by your parents, stay in regular contact with your with a person who is assisting for the better recovery, whether at home or way, like you may be office person. Encourage them to follow the rehabilitation program. Arrange appropriate home physiotherapy if it is really required for them. Initially, it is always required a month or two, right? You can also ask about their progress to the respective person. And most importantly, you have to celebrate small improvements that they are going through, right? And perhaps most importantly, be emotionally present. You may not be there physically, but your emotional presence is must. Sometimes your parent doesn't need another instruction. They simply need to hear. They just want to listen to someone saying, and especially if you're your parent's son or daughter, they would love to. And all you have to say is that I'm with you, keep going, you're getting better and better. So certain positive words keep the parents motivated in their process of recovery. And importantly, do not compare your parents' recovery with someone else's. There could be a knee transplantation or replacement of a young person, but your parent may be old. My parents' mother was walking in a week's time or 2 weeks' time. Those comparisons should not be done, right? So these are certain things that you have to take care. Like someone on YouTube recovered much faster. This could be certain things that you could be telling or maybe thinking about. So their journey is different from somebody else's journey. Every person has got their own time. So please don't use someone else's recovery as measuring scale for your parent. Age, overall health, strength, mobility, medical conditions, surgical factors, and many other things can influence the recovery. Your parents' recovery should be monitored according to their own progress. So everyone have got their own way of progressing. Know when to contact the treating medical team. At times, the medical team may not be always available. They have got their time, and also during the time of the parents' problems as well. You can involve recovery team during the swelling, during the pain, when some things changes. Once the leg is getting better, there could be a pain as well. Like if there is increasing or unusual pain or swelling, significant redness or warm around the wound, discharge or concerning symptoms involving the calf can always happen. So you can be in touch with the medical team at that point of time whenever required. And remember, YouTube can educate you. It cannot examine your parent. Your parents, surgeon, and healthcare team should remain the primary source of advice regarding their individual medical recovery. Right, these are some of the points which I had put across you. And also, one of the best things you can do is create a recovery system by yourself. Instead of asking all the questions that which could ponder them, like just a simple question that we usually use is that how is mom if it's to the father you have called to, right? Once every few days, create a simple routine, like be in touch. Like for example, on a week, if you are touching or calling your parent from abroad on a Sunday evening, make sure that you call on every Sunday evening, and maybe if possibly on the other day of the week as well. Like you could ask the questions, as I said, like how is mom walking, or how is the pain of mothers, how is the movement of mother, right? What activities have become easier at this moment? So this question can be easily asked. And what is difficult? What are the things which is making still the patient or may your parent be in a sense of dismayment? Like you could also ask that what kind of follow-up appointments are happening, is the rehabilitation continuing, are there any concerns more than that? So you could be asking these questions as well. This gives you a clear picture of what's actually happening back home. So as a good son or as a good daughter, you have to take care of your parents. These are some of the sweet gestures that you can give to your parents. And remember, the ultimate goal is for the betterment, right? For whatever problem they have gone through. The knee replacement is not a easy thing. It is psychological stuff as well. Most of the people feel like, why this has happened with me? First of all, you have to accept it, that certain thing has happened, right? Make the parents accept it, you yourself also accept it. Now what with this knee replacement it could happen is that they can become much better, they can walk better, they can stand better, right? They can move to the relatives house in much prolific way than what they used to struggle at the earlier stages, right? Most of the time it could be also probability like they could not be getting out of the chair, and maybe probably they could not be using the bathroom safely, they could not even climb the stairs appropriately. Like all these problems come out of the grave once a knee replacement is done. So take it positively, do not think like it is something which is a negation. And once your parents get back to, or maybe the parent who is ailing or maybe having the knee replacement, they get into their normal routine, you'll feel very happy, right? So these all are the things which I wanted to discuss today in this session for all those people who have been staying abroad and wanting their parents to recover in a proper and a prolific way. Take care of yourself as well. Make sure that you are in a great mood of being happy. First of all, being happy is an important thing, especially when your parents are abroad, when you are abroad and your parents back home. It's not that easy. So make sure that you are relaxed and make your parents also relax, right? What your parent need is the right local support system. Provide that local support system as what they needed, like a place like Spandhana Pain Relief Centre, where I'm working, where we assist the patients to get better and better through our rehabilitation and physiotherapy activities, which includes the anthropological instincts within that. So families living abroad, appropriate support can include assessment, rehabilitation, guidance, home physiotherapy, well, suitable exercise and progression, as well as communication with the patient is done. Your family may be abroad, or you may be abroad. Your parent may be in India. At that point of time, a local support system can really manage the things in a proper way. Right? Thank you very much for your presence and listening to whatever I've said. And we hope that if any of your parent is going through this knee replacement surgery or they have gone through, I hope for their speed recovery and get a wonderful life ahead. I'm Dr. Ashok Berry from Spandhana Pain Relief Centre signing off.